Hello, my name is Dr. George Rogu, and I am one of the many instructors for the website called AdoptionEducationClasses.com. Today, I would like to speak to you about the parental approach to the pre-adoption medical records evaluation and the blind referral. I just got my referral package. Some parents have described this time as a moment of great joy and happiness. One mother even mentioned it as being similar to the sensation one feels when they give birth to their biological child. Then they read the medical report, worry and concern set in. A portion of the adoption stress is created because of the unknown medical history or the confusing medical history that is found on the medical reports. Parents that become educated and knowledgeable about the international adoption medicine become confident in their referral. They will be able to make an educated decision. Unfortunately, in some cases, some families decide that the referral is not for them. This moment has been described as a moment of grief and sorrow, similar to the mourning that one experiences with the death of a child. So, I find my role as an educator, a counselor, a private detective, and lastly, as a physician. Now, what is my role as an adoption medicine physician? Our role is primarily to interpret the medical records. We plot the growth parameters on the standardized CDC growth charts. We try to educate the families in regards to possible medical problems that may be found on the reports. We review video footage and pictures. We try to comment on the developmental milestones that are observed on the videotapes. We speak about facial features and the body conformation of the child. Through this, we look for identifiable medical conditions. We also try to explain the bizarre Russian diagnoses which are often found on the medical reports, and we try to dismiss them accordingly if developmental milestones are successfully completed on the video footage. Lastly, we assign a risk category to the child. Now, what does an adoption physician not do? We do not pick out children for adoption. We do not decide which child to adopt and which one not to adopt. We do not give a warranty on the child's future health. We cannot tell parents if their child will be normal. We certainly do not place children for adoption, and we are in no way involved in the adoption process. Our primary objectives are education and knowledge. We try to answer questions that parents may have, and for those that are involved in the blind referral process, we are a lifelink back to the United States. We try to provide educational support during the entire adoption travel. This way, families never feel abandoned while they are overseas. Now, in regards to the history of international adoption, in the 70s and in the 80s, many of the children were younger, infants and toddlers. They lived in small foster homes and in small orphanages. These children received limited medical care, and their medical information was scanty at best. A majority of these children came from Asian countries. In the 90s to present, after the fall of the Iron Curtain, the majority of the children are coming from the former Eastern European bloc countries. These children tend to be toddlers and older children, and sometimes sibling groups. The majority of these children have spent a good portion of their young lives living in an institutional care setting. These children come to us with an array of more complicated medical and social issues, and the medical reports that we receive are sometimes full of unintelligible neurological diagnoses that often scare the potentially adoptive parent. What are some of the reasons why children are placed for adoption? The reasons seem to be universal no matter what country the children are arriving from. The most common reason is poverty. Other reasons are single parenting, involuntary termination of the parental rights, drug and alcohol abuse, incarceration of the parents, mental deficiency, and lastly, the parental death. The health status of international adoptees are also similar depending on what country they are arriving from, and each country has its own specific nuances. Now, infections are the most common conditions that we encounter, and the reason is simple. You have a lot of little children living in a confined environment with poor hygiene.